Hey guys, welcome back to my channel. For today, I have a very special guest, Miss Lorena 69. This is the first time that she's ever been on my YouTube channel, and today we are coming at you with a plastic surgery Q&A, and she's going to be talking about her whole experience with the surgery that she recently got done with Dr. Taneja. If you guys want to know more information on Dr. Taneja, I will be listing all of the details down below so you guys can check out his Instagram. His work is amazing, you guys, and we just both love Dr. Taneja. So I went on Snapchat and asked you guys if you had any questions. Go ahead and send me the questions on my Twitter because Instagram has been down all day. Both of our Instagrams haven't been working at all. So I'm going to go ahead and check my Twitter so that we can go ahead and start answering all of the questions that you have. My mom is going to try to answer the questions in English as best as she could. She speaks Spanish, so if she does continue the questions in Spanish, I will go ahead and leave captions down below in English for those of you guys who don't understand. So question number 1, what made you want to get surgery? It's because, okay, you guys, my mom's journey is so much more than just a Q&A. Like, I think it's kind of hard to let them know everything within, these amount of questions because my mom's story has been very, very long and hard. So I guess you can start off by talking to them about your weight loss journey before we start talking about the questions, because my mom actually had been overweight for many years. Like, I'm talking, we would always tell my mom, like, Mom, like, come on, let's go out and buy you clothes, and you would always be like, no, es que tengo que rebajar, quiero rebajar.
18 years?
Yeah, for 18 years. Like, I kid you not. We'll go ahead and insert pictures of what she used to look like. And then also, if you guys aren't following her on Instagram, I 100% recommend for you guys to follow her. I'll leave her name somewhere in this video so that way you guys can see pictures of her journey as well. She does upload a lot of pictures of her befores. If you guys were to have met her before, you would never believe that she would be sitting down right here filming a video for you guys, because plastic surgery is one of those topics that I feel like people are a little bit scared to talk about because it is a huge deal. Surgery is not a joke at all. And I feel like when we answer the questions in today's video, you guys are going to understand why. I was actually going to upload a vlog on my YouTube channel, but when we were actually going through her surgery, I didn't feel comfortable putting the camera on you because my mom was pretty much going through hell, and you guys don't really get to see the behind the scenes of what the surgery actually is afterward because it's very, very painful. ¿Cuánto tiempo estuviste así overweight?
De 15 a 18 años, pasada de peso.
¿Y por qué empezaste a subir de peso? ¿Qué fue?
Nada más me dejé ir. Me dejé ir y desgraciadamente uno como mexicano está impuesto a comer de lo peor, pero pues muy rica la comida. Pero sí, así nos criaron, nos crearon, así crecimos, y la rutina que tenemos es difícil cambiar de un día para otro. Te dejas ir, te ocupas en los quehaceres, en lo que sea, y ya cuando te das cuenta ya pesas como 50, 70 libras más. Y eso es lo que me pasó a mí.
Y también eres mamá de 3 hijos.
Básicamente dediqué la vida a ustedes. Y me olvidé de mí.
And I think that a lot of women, not only in the Latino community, can relate to that because I know a lot of señoras that have a lot of kids and they do the same thing. They cook, they clean, they take care of the kids, take the kids to school, practice, and they forget to take care of themselves. Yo siento que los tiempos ahora son más diferentes porque pues nos cuidamos más. ¿Me entiendes?
Básicamente se olvida uno de uno por cuidar los hijos. Uno básicamente nomás comes para vivir. Para sobrevivir.
Y luego el birth control that you were taking también. So, how much weight did you start at before you had kids?
What do you mean?
Like how much did you weigh? Sorry.
Oh, before when I just got married.
When you got married, no kids, no nothing. So that way they can kind of get an idea of what you look
134.
Like. You guys, my mom is drinking a tequilazo drink right now because she doesn't feel comfortable filming, but We really want to get this video out for you guys so that way you
Excuses.
can understand. Excuses? ¿De qué?
Pa tomar.
Oh, yeah. You know what? That's a whole other thing. So when did you feel like you were at your heaviest?
2 years ago.
2 years ago?
2 years and 2 months ago.
Uh-huh. And how much did you weigh?
270.
270 pounds. So she went from 130 all the way to 270 pounds in how many years?
In like about 16 years.
So what made you decide to lose weight?
I was sick. I was feeling sick. My blood pressure was really high. My cholesterol was high.
And the doctor told you?
Yeah, he told me either you lose weight or you're going to be on medication for the rest of your life. So that's when I decided that I needed to start losing weight.
And also, ¿qué no te dio motivación? Porque el doctor Taneja te dijo que para hacerte la cirugía te tienes que rebajar de peso,
Sí,
¿no?
sí, me dijo, tienes que rebajar de mínimo 40 libras.
Entonces, eso fue lo que te dio motivación para bajar más.
Ah, sí. Fue una de las motivaciones.
What did you do to lose weight? Did you take any pills? What did you do? Because I know a lot of people always want to know how people lost weight. And a lot of the times people take pills or they put injections, no? Like vitaminas or... So how did you lose weight?
I started eating healthy, going to the gym Monday through Friday, 2 hours every single day, and drinking a gallon of water.
And I feel like that's the hard part for everybody because everybody struggles to try to lose weight.
Yes, it took me 10 months to lose the weight.
And do you feel that even though people have jobs and they have kids and they have all these things going on, that could hold them back from losing weight, or you feel like you can?
You can do it. There is no excuses. Because I used to do that. I used to say, oh, no tengo tiempo. O voy a llevar a los niños a la escuela. O voy a trabajar. O eso.
O esa vida no es para mí.
No. Cuando lo quieres hacer, lo haces. Tú haces tiempo para lo que te importa.
So what made you want to get surgery?
Porque después de que perdí el peso, pues la piel me quedó flácida. Es obvio, tuve 3 hijos. Y luego con el peso que perdí, ya no iba a ser la misma de antes. So algún día me quedé pensando y dije, si lo voy a hacer bien. Pues es que la piel ya no queda igual. Ya no se te hace igual.
Y mucha gente dice, oh, si haces abdominales se te va a quitar eso.
No. Quizás si es poquito el problema, pero ya cuando estás hablando de bastante peso, de bastantes embarazos y la edad más que nada también.
What surgery did you get?
Tummy tuck and lipo.
Tummy tuck and lipo. So they did lipo pretty much all around, or?
They did lipo right here, I believe. Right here.
So on the back?
On the back, on my planks.
And then the front también?
No, not the front.
They didn't do the front? Oh, okay. And then they just pretty much cut off all your extra skin. Do you remember how much skin they took off?
It was a total of 15 pounds. No, skin 10 pounds and fat like 5. So a total 15.
Of like 14,
Both
15.
together.
How long has it been since you got your surgery?
It's been 4 months and a half.
And how do you feel right now? Like, do you feel like you can start doing things and, do you feel fully recovered?
No, not fully. Maybe like 80%.
And when you say 80%, what do you mean? Like, because I see you're here, estás maquillada,
Todavía duele un poco la cicatriz.
Right, but you can still do your everyday things like drive and everything?
Oh, yeah.
Okay, how long was the operation?
3 hours.
And I remember when my mom was in surgery, it was me, my sister, and then my dad, we went with her. And it just felt like forever. Like, it's really scary to have a loved one going into surgery because you do run risks. No matter what doctor you go to, no matter what, you're always going to run risks. Whether it's with the anesthesia, whether it's with losing blood, blood clots, like it's just, you just never know. So that's something that you guys need to take into consideration, because surgery is not a joke and it is not something to be taken lightly. The whole time you were in surgery, we were so nervous. Because we were just scared that, you know, something was gonna happen. And it's not only the person that's going into surgery that's feeling nervous or is feeling scared, it's also your family around you. But I think it's good that obviously you had family to like support you and go through this trauma, because it is a traumatic experience, not only for the person who's getting the surgery, but again, also the people who, you know, are your family or your loved ones, your friends, whoever.
Yeah, of course.
Do you have any regrets?
Not at all.
No?
No.
Did you ever feel like you had regrets when you were recovering?
At one point I did. Like maybe the second week.
The second
The
week?
second week.
Wow.
It was painful. Very painful.
Because when I got my boobs done, I remember I regretted doing it. Like, it was like the third day. But obviously my surgery does not compare to yours. But it was very painful for me. Like, every surgery is painful. Anytime they're going to put you to sleep, it's going to be painful. But I think everybody tolerates pain differently. So some people say that they're fine after 2 days.
I know.
So I've never met nobody. But like, you know, I see online and things like that. But for me personally, I felt like it was one of the most painfulest experience that I've ever dealt with. To me, getting my boobs done was so much worse than giving birth.
Really?
Yes. Well, because I got an epidural. So I felt
that's
the
why.
contractions. That's why, right?
Yeah, that's why.
But I felt it was very painful. What part hurt the most?
After?
Yes. Like, when did you feel like it was the most painful? Like, when you first woke up, were you like in shock and you were in so much pain, or did it gradually come after you woke up from the surgery?
I wasn't really in pain the same day, no.
Because of your anesthesia?
Yeah.
It takes time for the
It
anesthesia
started
to
like
wear off.
maybe the third day, something like that.
That's scary.
That's when reality hits.
How long was the recovery?
4 to 6 weeks.
4 to 6 weeks.
4 to 6 weeks.
Damn. So you got to make sure you call off work.
Yes, at least minimum 3 weeks.
And for those of you guys who are planning to get surgery, we would totally recommend for you guys to get those sillas. What are they called? The recliners?
Recliner.
Recliners are a must-have. If you have anybody that can lend you a wheelchair, or also one of those walkers.
A walker is
Because I felt like the hardest part of my mom's surgery was getting her down from the car inside of the house. And she was passing out. But the doctor said that it was completely normal for the patients to be passing out. So it's not something to be scared of. Any advice for anyone trying to get surgery? Like señoras at home or anybody who wants to get anything done?
Lo único que les puedo aconsejar es que si de veras la necesitan, se la hagan. Y si no es mucho lo que la piel que quieren que les quiten, no se la hagan. Porque es pesada la cirugía. Es pesada, es dolorosa y es riesgosa. Más que nada. Entonces, y otra cosa que asegúrense de que tengan ayuda de 3 a 4 semanas. Porque de 3 a 4 semanas no pueden ni bañarse solas.
Yeah, like a family member.
Sí.
My grandma was the one that helped you, because even I was too busy to be at her side all the time, because they need somebody to be helping them with the antibiotics, with the pain meds, with the anti-inflammatory for the muscles.
Even to get up to go to the restroom.
Even to get up to go to the restroom. Like, even to fix something, like if the pillow isn't comfortable,
You
somebody
can't do
to
it
fix
on your
it. So you need 24/7 care.
Y especialmente que se fijen bien con el doctor que van a ir. Porque no cualquier doctor es bueno para esta clase de cirugías. Cuando va a pasar algo, puede pasar con cualquier doctor, hasta el mejor del mundo. Pero pues ya esa sería una mala suerte, ¿verdad? Pero más que nada, asegurarse y investigar bien al doctor antes de que se pongan en sus manos.
And then also the person who's going to be helping you during your surgery needs to be completely comfortable with seeing blood,
Ajá.
with seeing juice coming out of
Juice.
the coming out of the drains, because I just get grossed out. Like, you know, I couldn't do it. I would just see it and you have to squeeze it, and oh my god, it's terrifying. So if you are not into blood or anything like that, you need to have somebody who is open to doing that, and also making sure to have a notepad to write every single little thing
Yes.
down. Are there certain foods that you recommend for people for after their surgery? Like, what are like some 5 things that you feel like are must-haves for your surgery recovery day?
Jugo de naranja, caldo de pollo.
Fresh squeezed, right?
Yes.
Yeah, fresh squeezed, because tienes asco from all the
Yes.
pain meds que ni se te antoja nada.
Jugo de naranja, frutas picadas. A mí lo que me ayudó fue la fresa y la naranja y sandía. Sandía.
And then also, please make sure to have your doctor prescribe you Zofran, because a lot of the times doctors won't give it to you if you don't ask. I mean, some doctors do give it to you, but I'm the type of person that I always ask. I need to make sure that I have Zofran. Zofran is a medication that helps relieve nausea, because with all the pain medicines that you're going to be taking, you are for sure going to be nauseated. Like,
Yes.
for sure. I feel like that's the number one complaint about people when they get surgery, is that their pain medicine makes them feel so nauseous that they'd rather feel the pain.
Norcos.
The
yeah.
Norcos. You took Norcos, or what
Norcos.
medicine did you take?
Norcos.
And then you can also take half of the pill too, because then you won't feel as nauseated, and you have to make sure that you're eating when you're taking your medication. Always. Because you'll throw it up,
Oh yeah, you will.
and you can't throw up in this situation
No.
that you're in. But you did, huh?
I did twice.
Was it really painful?
Yes.
Very,
Very painful.
Yeah. Just thinking about it makes me sick. Okay, do you recommend the surgery?
Sí la recomiendo, porque yo quedé bien satisfecha, 100% satisfecha, y ahora me pongo a mirar las fotos de antes y ahora, y wow, qué cambio. Pero como les dije, asegúrense de que hagan las cosas bien y se preparen, porque es una recuperación larga, muy larga.
Did you feel like you were reborn into a new person? Like, you feel like you're a new person?
Yes, I do feel.
When did you finally feel, after you got the surgery, that you could get up and start to do a few normal things again? That you're not in pain and you're okay?
La tercera semana más o menos. Es cuando ya me
third week.
pude levantar y ya bañarme sola. Hacer
Oh, you
cosas.
could shower? But you do need help taking a shower
Yes.
when you're going through the recovery.
You do need help.
Yeah. Do you feel like you would recommend Dr. Taneja to other people and people who are watching this video?
Claro que sí. Lo recomiendo 100%. Es muy buen doctor. A mí me dejó exactamente como yo quería. Lo que yo le pedí fue lo que me hizo.
If not more. I feel like he outdid himself with the way that he left your shape.
Sí, muy buen doctor, responsable y pues sí lo recomiendo.
Bien atento.
Muy atento, al pendiente de sus pacientes.
We would not be filming this video right now if I felt 100% in my heart that Dr. Taneja was not a good doctor to be promoting like this publicly on social media. I feel like Dr. Taneja is a doctor that is reputable and does know what he's doing and is very responsible with his clients, as well as his work is amazing. You guys can see on his Instagram before and afters, his boob jobs are amazing. He gives you that look, that very sexy look that I feel like a lot of doctors don't execute. Because you know, a lot of doctors, they do the work, pero no queda el shape bien.
No te
Como-
y la cicatriz.
See, oh my god, the scar. Let's talk about your scar. I was scared about the 360, because was it a 360?
Mine?
Yeah.
No.
Oh, so te queda poquito detrás.
No, mucho. Mine is from here to here.
Oh, okay, so from hip to hip. Okay. I was actually scared that the scar was going to be visible, but his scars are phenomenal. You cannot even tell. Obviously, you can tell that there's something, right? You have a scar. But how would you describe it?
Está muy bonita mi cicatriz.
Uh-huh.
Es como una línea de un lápiz, nada más así.
Because I have seen a lot of people who have gotten tummy tucks and their scars look very, very visible. That's something also to take into consideration when getting the surgery. But Dr. Taneja knows how to make it very, very seamless. Because when I saw it, and I had seen it when you were like 2 months out of surgery. And I was in shock. I think it was when we went to his follow-up.
Oh yeah.
Remember? And I was just like shook because I couldn't believe how nice he left the scar.
Y mucha gente me pregunta cuánto le costó la cirugía. O sea, no, cada quien es diferente. El precio de cada quien es diferente.
They won't know until they go to see him.
A la primera consulta, lo que ocupan que les hagan, ahí él se basa eso para el precio. O sea que de nada sirve que yo les dé mi precio si el de ellas va a ser diferente.
Yeah, so we recommend for you guys to book a consultation. You won't know until you actually meet with him in person because everybody's situation is different. So you might need less of a scar. Do you know what I mean? And at the consultation, you can write down all the questions that you have for the doctor. Don't ever feel like you're asking too many questions because this is a surgery and you just want to make sure that you go home knowing that all of your questions were answered. And I really hope that we helped answer a lot of the questions that you guys may have, because I feel like this is something that everybody has been dying to know about. They're always asking me about how you're doing, and they always want to know certain questions that obviously I can't answer because I didn't go through this situation. My mom did. So we really hope that we answered all of your questions. If you guys have any more, you guys can go ahead and ask them down below, and you guys can follow my mom on Instagram. She always answers a lot of questions on her posts, also Insta stories. So you guys can go ahead and follow her on there.
Claro que sí. Cualquier pregunta que tengan me pueden mandar un mensaje en Instagram. Yo estoy ahí a sus órdenes para ayudarlas con mucho gusto.
Well, thank you for coming on my channel. I think everybody is going to appreciate that you came on here to answer a lot of the questions that everybody's been wanting to know. I really hope that you guys enjoyed this video, and if you have any other video requests, just go ahead and leave them down below. And as always, all of the information that you guys need to know will be in the description box below. And yeah, I will see you guys all in my next video. Bye.
Bye.
Okay.